We mentioned the Department of Veterans Affairs is the first major federal agency to require healthcare workers to get COVID-19 vaccines. And while Defense Department senior leaders have said preliminary discussions about making the COVID-19 vaccine mandatory, Morning Joe Chief Medical Correspondent Dr. Dave Campbell examines the vaccine hesitancy that looms large among U.S. troops.
With the highly contagious COVID-19 Delta variant accounting for over 80% of infections and a third of America's military still unvaccinated, the question looms, what will it take to combat the hesitancy that remains among our service members? We flew to the Pentagon for an update from Assistant to the Secretary of Defense John Kirby. What's the kind of general concerns that the military is having now with surging Delta virus?
It's certainly something we're watching very closely, and we are redoubling our efforts to inform and to educate and to try to influence people to understand the value of these vaccines and to go get them. If the FDA were to approve the vaccines, Secretary Austin and the leadership here would take a look at and examine the efficacy of maybe moving to mandatory vaccines. But we want to give time and space for the FDA to do their job.
Is military preparedness part of the issue that you are worried about?
Absolutely. Now, we haven't seen any operational impact to our units and our ability to defend this nation as a result of the virus. It's not that there haven't been units and bases and ships here and there who have had outbreaks. They absolutely have. But as a force, we're still able to defend the country. We think part of the reason for that is that we have been so aggressive and informative about the safety of the vaccines and encouraging people to go get them. Getting vaccinated is making sure that you are healthy, that you are ready to defend the country. Just like if you want to make sure your weapon is clean and that your ship is ready to get underway. All the things that go into readiness, this is part of that. And so you're not just helping yourself and keeping yourself from getting sick. You're helping your unit, your ship, your platoon, your command, make sure that they are ready to defend this nation. That's what this is all about. And so we're trying to make sure people look at vaccination in a much more holistic way. It's about protecting your team, your family, the community, and, of course, your nation.
Only 35% of our available population that could get the vaccine has been vaccinated.
Throughout the pandemic, Alabama's Fort Rucker has been navigating the challenge of maintaining critical training for pilots in close quarters. On our way to Fort Rucker, a local hospital highlighted the deep connection of the military in their community and the danger Delta variant poses in a state that is almost two-thirds unvaccinated.
We are definitely seeing an increase in numbers of cases, and they definitely appear to be from Delta variant. Our patients are shifting younger. This time last year, 2% of our cases were children. Now about 20% of our cases are under the age of 18. We treat active duty military members, their families, as well as our independent contractors on the base. They're really a big part of our community and very important to us.
At Fort Rucker, Major General Francis spoke to continuing operations through this new wave of infections.
As we get ready to implement new procedures, we communicate with the local community and our local force here at Fort Rucker to ensure that we're communicating why we're doing it, what conditions are driving us to do that. The vaccination works. It has reduced the number of cases that we've had at Fort Rucker since we've implemented vaccinations. And for those that aren't vaccinated, we still have them using all of the mask protocols that were in place prior to the vaccinations getting here. It remains voluntary, but we certainly encourage our folks to get the vaccine. What's particularly challenging about for us here at Fort Rucker is that we launch 400 aircraft a day in confined spaces. As we see conditions changing around us, we've made the decisions with medical guidance and with guidance from the CDC and from the Department of Defense and Department of the Army on the procedures that we were going to put in place to ensure that we can continue to produce aviators for the United States Army.
The military is a reflection of America. They watch Fox News, they watch Msnbc, they listen to leaders, they listen to talk radio, and they are influenced just like everyone else in America.
Iraq War veteran and 9/11 first responder Paul Rykoff then shared his perspective on military vaccine hesitancy.
I was required to take more vaccines than I can count. When you're in the military, you don't get to opt out for personal reasons. You're supposed to put your personal allegiances and priorities to the side for the betterment of the unit and the betterment of our country. Our military has to be about the best and brightest. And if you don't understand the impact of vaccines, you're probably not right for the American military. In the military, you have this unique ability to make people do things. You can make people go to war. You can make people lose weight. You can make people take vaccines. That's part of why the military is effective, is because you can get everyone on the same page. So the president here, in my opinion, has dropped the ball. He could have mandated that the military be among the first to get the vaccine, to show that our military is courageous, that our military is willing to demonstrate leadership and selfless sacrifice for the rest of the country. He's the only commander-in-chief in a generation who's had a child serve in combat. Both served in the military. President Biden understands what it's like to send a kid to war, so he can speak to the military in a way, in a personal way, that most people can't. If they can pull out the War Powers Act to produce vaccine, they can find a way for the president to mandate the vaccine to everybody in uniform. And if they don't understand, it's a great way of weeding out the people who don't want to be on Team America. This is literally a choice between standing with America or standing with our enemies. Either you're with us or against us. Whether it's January 6th, 9/11, or the vaccine, we've all got to be on the same page, or our enemies are going to be celebrating.
How right
really strong.
is Paul Rieckhoff? How right. Great package.